Alright, we are continuing our skeletal system week by wrapping up with chapter 8, which is joints. So we are going to look at some different ways of classifying joints of the body. We have both functional and structural classifications. We're going to talk about some different examples of these different types of joints in the body and look at some examples of them. We're going to go over some different body movements, and this is going to be a really good setup to our muscles topic, which we'll be covering here in a couple more weeks after we finish the skull. And then we've got some special body joints that have specific structures and their movements that are allowed by the different types of joints. And then we'll touch a little bit on how these joints develop. Alright, so starting off with classifying joints. Again, we've got two different ways of classifying these, and so we'll look at some examples of these and see how these function. So joints are also sometimes called articulations, and these are any place where two different bones or adjacent bones come together, or bone and cartilage come together, and that is called articulation. So that coming together of bones or bone and cartilage is an articulation, and they're going to form some sort of connection. So joints are classified functionally based on their degree of movement, which means how much that joint moves. So can it do big movements, or does it only do very, very small minimal movements? And then we can also classify joints structurally based on the style and how the bones and cartilage come together and how they're connected. So functional classification of joints, again, is determined by how much movement is found between adjacent bones, and we have three functional classifications. This is a synarthrosis, which is an immobile or nearly immobile joint, so one that does not move. Then our next classification is an amphiarthrosis. This has limited mobility, so it can move a little bit, but not a ton. And our last type is a diarthrosis, which are freely mobile joints, so these have a lot of range of motion to them. So a synarthrosis, a great example of this are the sutures of the skull. So we'll learn some of these sutures when we do the skull next week. But these are immovable joints, and so these are fused together through connective tissue, and these bones are pretty well stuck together, and so they are not going to allow a lot of movement. So remember in a previous video we talked about development of some of these bones of the skull, and there was a lot of connective tissue in between those different bones, and so that connective tissue does slowly shrink and pull the bones together as they get larger as we grow, until they're fully fused together. Alright, so these are joints that do not move at all, which is why as adults swelling in the brain can be a big problem, because these joints are not going to be able to separate from each other, allowing that space to expand and stuff like that. So that's why swelling in the brain can be a huge issue, is we do not have any movement of these joints. Amphiarthroses, again, these are minimal movement, and a good example of this has to do with our spinal column, and so the joints formed between the vertebrae and the intervertebral discs are examples of amphiarthrosis. So you can move your spine. Obviously we have some degree of movement in our spine. We can move a little bit, but there's also a lot of limitations to how freely we are able to move that spine. And if you're looking at just a single one of these joints, there's not a lot of movement that's happening in a single individual joint. And a lot of our range of motion in our vertebral column comes from the fact that there are multiples of these joints located all up and down along our spinal column that allows us some of that degree of movement that we actually have. And last but not least are diarthrosis. These are also sometimes called multi-axial joints, and these are going to be those freely movable ones, which make up a significant portion of the joints in our body. So hip, shoulder, elbows, knees, stuff like that are all diarthrotic joints. That brings us to the structural classification of joints, and we have three structural classifications. The first is a fibrous joint. These are where adjacent bones are connected by fibrous connective tissue. Cartilaginous joints are joined by hyaline cartilage or fibrocartilage. And then synovial joints are where the bones are not directly connected to each other, but they're going to interact with each other within a joint cavity filled with a fluid that helps allow free movement. All right, so fibrous and cartilaginous joints, these are bones being joined together by either fibrous connective tissue or cartilage. Synovial joints are going to have that joint cavity in them, and there's going to be a lot of ligaments that are attaching those bones and kind of keeping them anchored together. All right, so let's look at fibrous joints. And we're going to break these down a little bit, so we have some different types of these fibrous joints that we'll look at, and we'll see some examples. So again, we're connecting these by fibrous connective tissue. We have three types: sutures, syndesmosis, and gomphosis. All right, so we already touched on sutures a little bit. These are in the skull, so we've got that fibrous connective tissue that's going to hold those bones together very, very, very tightly so that these are not moving. They're not going to separate from each other. In the middle here, we have a syndesmosis joint, and this is formed by the ulna and radius in our forearm. And so you can see there's a lot of connective tissue right here in between them, kind of holding those two bones next to each other. And this is also going to allow these bones to actually twist over each other when you're standing naturally. So your palms will either be in towards your sides or more towards the back. So those bones cross over each other, but they're still kept together by this fibrous connective tissue. And then over here in panel C, we have the gomphosis joint, and we see these in the teeth primarily. And so we have this periodontal ligament, so really strong fibrous connective tissue that is helping to anchor the tooth in the actual socket of the bone in our maxilla or mandible, which are the upper and lower jaws. Next up is cartilaginous joints. So we'll talk a little bit about those features. We've got two different types of cartilaginous joints, and we'll see some examples of those. So these, again, bones are united by cartilage, either hyaline cartilage or fibrocartilage, and these can be either synchondrosis or symphysis. So we saw an example of a symphysis already. But that epiphyseal plate that we've talked about in some other videos for this week's material, this is, again, that temporary hyaline cartilage, but this does function as a joint. All right, so we are looking here at that fibrous, or not fibrous, that hyaline cartilage joint there at the ends of the bones, forming that epiphyseal plate. And so that hyaline cartilage obviously is going to disappear over time, and so we will lose that particular joint. But this is a joint because, remember, we have that primary ossification center down here forming the longer portion of those bones, that medullary cavity, and then we get those secondary ossification centers up here forming the proximal and distal ends of the bone. So briefly, it's kind of like these are two separate bones until we replace that hyaline cartilage template with that bony tissue so that we can finish growing those bones finally. And then over here in panel B, like I said, we've seen this already in our lab material. So the symphysis, this is the pubic symphysis. So it's that cartilage disc in between the pelvic regions of those two coxal bones. So that is an example of a symphysis joint, whereas this epiphyseal plate is a good example of that synchondrosis cartilaginous joint. Another place that we can see this synchondrosis is between the anterior end of a rib and the costal cartilage that connects into the sternum. So that's another place we see that. But the main place we see the symphysis here is in the pelvic region. All right. So those are a couple types of our cartilaginous joints. And last but not least are synovial joints. This is the most common type of joint found in the body. There are a lot of components to it. We've got the articular capsule and cartilage, we have the synovial membrane and fluid, and then we've got lots of ligaments that are going to help keep those bones together near each other. And then there's some additional structures that we can find within synovial joints, meniscus and bursa. All right, so this is a diagram of what a synovial joint looks like. So we've got these two different bones, and they're going to have that articular cartilage on the ends of them that we've seen in some other videos this week. So we've got that articular cartilage, and then we have this fluid in between the two bones, and that is the joint cavity filled with something called synovial fluid. So this is that lubricating fluid that I mentioned earlier that's going to help these be freely movable joints, all right, and reduce a lot of the friction and stuff like that. But as you can see, versus other joints that we've looked at already, these bones are not directly connected to each other. We've got that synovial space, that joint cavity in between them. And then that entire cavity is surrounded by the articular capsule, which is formed by this fibrous tissue out here. We've also got that synovial membrane a little bit further in that's containing all of that synovial fluid. And then we've got that articular capsule that's kind of keeping everything together. It's anchored to both of the bones all around the joint. And so that's going to kind of help assist all of the ligaments and stuff that are also connecting all of these bones together. All right. We do not have blood vessels in these joints, as you can see, and so this is why a lot of this cartilage, this articular cartilage, does break down slowly over time, is we don't have a lot of blood supply into our joints, so we're not really able to keep a lot of nutrient flow coming into those chondrocytes. We get a little bit of nutrients that kind of diffuse into the synovial fluid, and pressure from compressing these joints while we're moving can kind of force some of that into the cartilage, but that's not super effective. And so that's why a lot of our synovial joints can sometimes be the first ones to start having issues, and this is why we start seeing hip replacements and knee replacements in older people, because this articular cartilage just starts breaking down, and we need to give it some help to keep those joints at least somewhat functional. Certain joints, like the knee, are going to have the meniscus and some bursa in them. So these are just some additional structures found within these synovial joints. All right. A meniscus can also sometimes be called an articular disc. So again, that's another cartilage piece. These tend to be a little bit larger and kind of C-shaped, all right, and they're just going to provide some extra cushioning. We saw those in the knee joint already, the medial and lateral meniscus, and so those are going to be in between those two layers of articular cartilage in there, and then in our knee we've got the posterior and anterior cruciate ligaments helping to anchor those bones together within that synovial cavity. All right, and that articular capsule. And then kind of coming a little bit out here towards the anterior side of the knee, we start seeing these bursa. All right, bursa is a thin piece of connective tissue forming a sac filled with some more lubricating fluid. And so we've got the patella right here, or kneecap, and so you can see that there is a bursa sac here kind of behind that tendon. This is the quadriceps tendon, and behind that patella right there to add in some extra cushioning for that tendon and the patella. We have a bursa outside of the patella, very, very small one, but it is there. And then we've got another one lower down closer to that tibia. That's also going to help provide some cushioning for that patellar ligament that's connecting from the patella down onto the tibia. And so these bursa are just offering some extra cushioning in certain regions where we have a lot of these additional structures happening, to just help reduce a lot of that pressure and friction from rubbing on the tendons, ligaments, bones, and stuff like that. All right, because we don't really want all of these things rubbing directly against each other. So we have a bunch of types of synovial joints, all right, and so these synovial joints are based on the shapes of the articulating surfaces. So we've got pivot, hinge, condyloid, saddle, plane, and ball and socket joints. So here are some examples of the different types of synovial joints. And so a pivot joint, this is going to be like a post that has a structure around it that's going to pivot. So an example of this is between the atlas and axis, C1 and C2 vertebrae. So that DENS process on the axis is forming that pivot point for the atlas to rotate around. So that's one type of synovial joint. All right. Next up is a hinge joint. We see this with the elbow as well as the knee. So these are joints that are going to move pretty much in just kind of one direction. So it can bend and straighten, but it can't move side to side. It's just going to be able to bend and straighten for these hinge joints. So again, elbow joint's a great example, and then as well as the knee and ankle and some other places in the foot. Next up, we have a saddle joint. So this will kind of have a little bit of a saddle shape to both of the bones. So it's concave in one direction, convex in another. And this is going to allow these two bones to fit together like somebody actually riding a horse using a saddle. These are also sometimes called biaxial joints. We don't see a ton of these in the body, but we see some in the carpal bones in the wrist. All right. For how those carpal bones can fit together. There's a specific one that allows our thumb the ability to move away from the palm of the hand. So this is a really important joint that allows us to have opposable thumbs like all primates do. All right. And then our sternoclavicular joint, so up here from the sternum and clavicle, that's also an example of a saddle joint. Next up is a plane joint. We see these between tarsal bones, and a plane joint is going to have a gliding action. All right, so the bones are going to be flat or even slightly curved, approximately the same size, which allows them to kind of slide across each other. These are usually going to be really small joints and pretty tightly held together with ligaments, so there's not going to be a lot of sliding. Obviously, we don't want a lot of sliding in our ankle joint because that leads to some issues. So we can have multiple directions of movement with plane joints. A little bit of rotation, but mostly sliding. These are also sometimes called multi-axial joints. But again, we've got a lot of limitations on the degree that we can move, so how far we can move, because those ligaments are holding them together so tightly. So we do see some plane joints between some of the carpal bones, and then definitely in the tarsal bones of the ankle and foot. Next up is a condyloid joint. We see this formed between the radius and carpal bones in the wrist. So this is also sometimes called an ellipsoid joint. So we have a shallow depression at the end of one bone and then kind of a rounded structure on the other bone of that particular joint. So again, forming between the radius and carpal bones is going to be an example of a condyloid joint. And so this is going to also be a biaxial joint, so we can move in a couple different directions, but not all directions freely. We just have a couple planes of movement. So this can allow us to bend and straighten the wrist and fingers, and then we can have a little bit of side-to-side movement. All right, so that's how you can kind of move your wrist around, but it's mostly just a bend and straighten or side to side. It's kind of harder to really move it truly in a free circle. And last but not least is our ball and socket joint, hip joint, shoulder joint. These are ball and socket joints. So this is going to be the ball-shaped structure of one end, like the head of the femur or the head of the humerus, sitting in some sort of depression. So that would either be the glenoid cavity on the scapula or the acetabulum on the coxal bones. These have the largest range of movement, which is why you're able to move your arm in a total circle at the shoulder joint, because these have such a large range of movement. These are also the most unstable type of joint that we have because they have such a big range of motion. So there is a little bit of a trade-off there. And these are again going to be held together mostly by ligaments, and so those ligaments can get damaged. So rotator cuff injuries in the shoulder is because all of those muscles, tendons, and ligaments got damaged, inhibiting movement a little bit. And it's easy to do with joints that can move this freely. So they're not as stable as some other joints, but they do give us a lot of movement. So all of these joint types have pros and cons to them, is kind of the moral of that story. All right. We will continue talking about types of body movements in the next video.